The mission of the Cancer Alliance is to reduce the burden of cancer for all Minnesotans. We do our work by having 19 strategic objectives in our cancer plan, which goes from 2015 to 2025. So we're looking forward to writing our next cancer plan. What we do is a lot of our members come together in this collective action model to work on one of our objectives. And through that, we also have small grants, strategy action grants, that are available for a group to come together and do their work. We have a backbone organization with Minnesota Department of Health. They provide some help to make sure that we are looking forward and doing the things we need to do to reduce that burden of cancer.
The people come from all different backgrounds and roles. There's community people, there are clinical people. It's just a wonderful example of coordination and movement on this thing called cancer in Minnesota.
The way we do our work is really through committees and networks. So for example, our Cancer Clinical Trials Network has been focusing on increasing awareness and understanding of clinical trials across the state of Minnesota.
We've learned a lot of things about cancer in Minnesota over the years. Some cancers are preventable. Early detection is important for improved outcomes for cancer. And we're learning more about how social determinants of health, things like housing, transportation, those kinds of factors are placing people greater at risk.
When we wrote the cancer plan, health equity was an underlying thread that went through all objectives. So the Cancer Health Equity Network comes together and they talk about what are health equity issues in cancer across the state. We've also worked really hard to make policy a part of everything we do.
Wilder Research has been the evaluation partner of the Minnesota Cancer Alliance since about 2017. They do fabulous work, and we're proud to be partnering with them to track indicators related to progress on the cancer plan, as well as try to tell their story on how they've been successful. In 2020, we worked with the Evaluation Advisory Committee to produce a dashboard related to the indicators in the cancer plan. One of the indicators we saw had changed was indoor tanning rates had gone down. We think part of this may be because the policy committee had advocated for legislation change that was passed. We're currently working on an update to the dashboard that will be forthcoming in the next couple of years.
We are a membership-driven organization, and we love to have new members. We really invite you to help us with your passion to reduce the burden of cancer for all Minnesotans.